Welcome everyone to today's WAS webinar on WAS 2025 to 2029, New Horizons, Global Reach. Introducing the new leadership of WAS. My name is Renee de Klerk and I am the Executive Director of WAS. I am delighted to be your host. The World Association for Sexual Health is dedicated to advancing sexual health, rights, justice, and pleasure for all. Through these webinars, we aim to share knowledge, encourage discussions, and engage with experts worldwide on critical issues affecting sexual health. Today's experts form the new leadership of WAS, and we look forward to what you will share with us today. I will introduce our first speaker, Faysal Alkak, our newly elected president. Faysal is an associate professor of OBGYN sexual health and the director of the Women Integrated Sexual Health or WISH program at the American University of Beirut. He will speak about WAS, the power of global solidarity. Welcome, Faysal. A warm welcome to you. You can go ahead. Thanks.
Thank you very much, Renee. I'm very pleased and I'm very honored to be the new elected president of this amazing association. And I'm happy to welcome all of you from the different corners of the world, members of WAS, friends of WAS, colleagues, activists, academicians, researchers, head of organizations, and from all walks of life that you're here to promote, to protect, to guard sexuality and sexual health and rights. I will start sharing my presentation, your solidarity, and our all collective responsibility. I have nothing to disclose. We cannot speak of solidarity without speaking of the amazing official federations of WAS in the North America, in Europe, in the East Mediterranean, in the Asia Oceania, in Latin America, and of course in Africa. And that's important. And you might always ask why solidarity and why now? To all of us, it might be really more pressing nowadays than ever before, because we are all now living in an interconnected world by many means. We have seen COVID-19 impact of one virus on the planet. We've seen the impact of conflicts, of wars, but also the impact of social networking, artificial intelligence, digital platforms, and others. So we share many challenges together. And that's why solidarity remains a shared responsibility and not a charity, not an act we do at our free time. Our collective voices are stronger than our individual efforts. As we speak, we continue to face global challenges related to sexual health. As you can see on this recent WHO map of various colors reflecting issues related to data, to access, to availability of sexual and reproductive health and rights. And some of these really sad numbers indicate that 800 women, unfortunately, continue to die from preventable pregnancy-related causes, and millions continue to lack access and availability of contraception, HIV services, sexuality education, and abortion services. In around 67 plus countries, they still criminalize same-sex relationships. The stigma, the silence, and the disinformation persist to threaten sexual health and rights. In this recent interesting paper published in The Lancet in 2024, showing the importance of insufficient national data on sexual reproductive health and rights and their impact on the well-being of individuals. And you can see in these slides that the harmful traditional practices such as child marriages, female genital mutilation, as well as politicization and policing of sexual health continue to be a major challenge, preventing us from attaining higher levels of sexual health and rights. At the same time, there are insufficient progress in addressing social determinants of health, including stigma, discrimination, violence, human rights violation, and gender inequality and inequities, more so these days. In addition to persistent high mortalities, morbidities due to lack of accessible, available, acceptable, and quality sexual reproductive health services and products, including the self-care interventions, which is released lately from the WHO in 2 volumes. There are also new and emerging threats, wars that we live, displacement as an outcome of war and natural disasters, climate change crisis, as you can see, drought, massive displacement. As we speak, there are 90 million people who are classified as displaced people by the UNHCR. And of course, war and the miserable outcome of war. There is also the digital misinformation, disinformation, and the shrinking space in relation to civil society and civil rights. And of course, shortage of funding for health systems and the backlash on rights. At the same time, we have opportunities and we have progress. And I'm sure you're all part of the progress happening somewhere on the planet. Policy reforms, integrating sexual rights into the universal health coverage, more and so emphasized by WHO and more so emphasized in the SDG 2030, leaving no one behind, including, of course, sexual health and rights, access and services. Youth leaderships and grassroots advocacy, you can see that from all the youth organizations in Africa and many parts. You can see that on the social platforms and in the digital space, and that's exemplified by innovations like apps, telemedicine, telehealth, platforms, and many others, and also cross-sector collaboration between health, education, services, and law, emphasizing the collective responsibility of all of us and of all disciplines that will come together to promote sexual health and rights. And definitely there is a global momentum 5 years into the 2030 SDGs. The SDGs, they have put the sexual health at the center, whether in the SDG 3, 5, or even 4 and 6. There are rising global awareness on gender, equity, and well-being, and their meaning and their implication to services, implication to education, and also shared scientific knowledge that will accelerate change, as you're going to hear from my colleague and board member, Erick. And that's why solidarity matters. And if you still question why it matters, because no country can succeed alone. Because sharing resources, being here like today, all of us together, sharing knowledge, being resilient, and doing that together is important. Because also solidarity amplifies marginalized voices and is an agent of these marginalized voices. It's an agent of those that are left behind. And also solidarity builds collective resistance to regression. Again, why it matters? Because challenges that we face, like GBV, like access to contraception, stigma, digital divide, others, south, north, and all many and other things, because of the global interdependence in displacement, in civil rights and spaces, and also in the risk of sexual health and rights falling out, whether it is a political crisis or a military crisis or a natural disaster. Unfortunately, the first thing to fall out is sexual health and sexual rights. And that should be prevented and protected. And also, solidarity matters because of human rights. And because, as you all know, and as was always advocate, sexual health is inseparable from rights and the human rights. And that's why, as I said before, solidarity is necessity, not charity. And why WAS can lead this? As I said before, because of all of you in this meeting today, and because of all of us in these federations globally, we have 6 federations, 6 amazing, effective federations. And because we have a global reach and members in 100 and more countries, and because we have the authority, we have the say, and we have the history of 50 years in guarding and advancing sexual health and rights through meetings, research, declarations, and global collaboration. And because of the WAS convening power, because of the expertise we have, because of the knowledge we have and we generate and we accumulate, and because we have uniting disciplines and sectors. You have the medical doctors, the social scientists, the psychologists, the anthropologists, the activists, the academicians, the researchers from all walks of life. And because of the power of advocacy that WAS have as a recognized, respectable, and reputable voice, not only within the UN walls and UN chambers and rooms and spaces, but also with other partnerships with reputable international, regional, and national organizations. And because WAS is a catalyst and will continue to be a catalyst and a leader for global solidarity. WAS can mobilize the solidarity because we're gonna do that, not only because of the things I mentioned before, but also because of our ability to close the gaps of North and South, because of the ability to twin, to join, to build collaboration South-South and South-North, and because, as you're gonna hear my colleagues saying, of the upcoming meeting of the World Sexual Health Assembly next month in Porto, and because also of the training, because of the knowledge sharing, not only knowledge generating, and also because of supporting communities that are marginalized, communities of disabled voices, and of course, because of the digital power. So I will end up with a call to solidarity and action. I'm going to call you all for help, for collaboration in our new term to start together with this act of solidarity, sharing work, commitment, and responsibility, standing together to defend rights and dignity, and also galvanize our power within the WAS mandate, networks, and responsibility, and work to ensure really what we claim, sexual health and rights for all. These are some of the expertise and byproducts that we have, the famous declarations on sexual justice, sexual rights, and sexual pleasure. This is our contacts. I'm sure all of you know how to reach us through the social platforms, through the emails, and many other venues. This is our journal where we generate the knowledge and spread the knowledge of the research. You're most welcome to submit and to ask any questions related to research. Erick will be working on some kind of a research workshops to improve the skills of researchers within the WAS community and also other communities. And definitely the jewel of the crown is the World Sexual Health Day coming up in 4th September 2025. You have all these resources to use. You have all the freedom, all our support to make your own events locally at the university, in the school, in the country, in the region, and make use of this day to promote the sexual justice theme for this year. And I thank you all for being here. And I call you or ask you to book your calendars for the June, for the upcoming meeting in Cape Town in 2027. And thank you very much. I will be happy to see your questions and comments later on. Now, it gives me a pleasure to introduce our next speaker, our friend, and also a board member, Erick. Erick is from Belgium. He is the Secretary General and the Treasurer of WAS. Erick is a professor in sexology and director of the Institute for Family and Sexuality Studies at the University of Leuven. And he will be talking about from evidence to impact, advancing global sexual health and rights through science. Welcome, Erick.
Thank you so much for that nice introduction. So I indeed will be talking a bit about the role of science in WAS and things that we have been working on and thinking about for the future. Obviously, a strong, important focus of our organization is on the promotion of sexual health and rights, and the place of science, research, knowledge is actually part of our mission. We want to accomplish these goals by advancing sexology as a science and through science-based sexuality knowledge and research. Some main tools we use to basically put science within the basic mission of WAS is through its scientific committee. One of the statutory committees is the scientific committee. And of course, as our president just already showed, we have our own journal, the International Journal of Sexual Health, which is led by Eli Coleman as the editor, and which is a peer-reviewed journal covering a range of disciplines, including sexology, medicine, psychology, sociology, and more. All of you are probably aware of the existence of this journal, but this is the official journal of WAS. And then our scientific committee, I had the honor and privilege to serve as the chair the last 4 years. And with Terry Humphreys and Krista Marcus, then vice chairs, and they are now the chairs of the scientific committee for the next 4 years. And they lead of this committee and do that work for the conference. The role of the scientific committee is to evaluate abstracts, but the scientific committee is also responsible for the scientific program and the proceedings of the Congress. The committee also contributes to and assesses the scientific foundation and assumptions of WAS statements, and advises the officers and committees when they want and when they are taking part, for example, in global discussions and decisions. And in addition, the committee aims to facilitate and further develop scientific activities among WAS member organizations. So a lot of things are happening around the world that Faysal already discussed to a large degree, and also when it comes to research and science, there are a lot of things happening that are worrisome and that also require, I think, a response of our organization. Of course, the sexual health research is and has been under threat. There's a long history of underfunding and marginalization, and there are serious concerns about the growing presence of dis and misinformation in the areas of gender and sex education, for example. In the USA, NIH, the National Institutes of Health, research has been under attack. In May, early May, almost around $1 billion US dollars in grants were cancelled, and almost half of them addressed the health of sexual and gender minority groups. In Europe, I live in Europe, and it's an interesting observation, I think, that the EU doesn't really have a specific focus on sexual health research, for example, through the ERC or Horizon framework, which is unfortunate. There are no specific sexual health related review panels, for example. And at the global level, of course, research is censored or silenced in many restrictive contexts and countries. So right now, it really does seem worse than ever, especially the funding climate and of course, the impact of the US goes way beyond the US itself, also through collaborative research and the funding of other organizations that stimulate and inspire and also facilitate research in countries all around the world. I've had my own experiences with this when I still worked at the Kinsey Institute years ago in the US. One of my grants, my first federal grant, was already considered government waste, and was voted on in Congress in 2003. Of course, a difference with the current situation is that I managed to keep my funding. But clearly, this is a old problem that recently has seen an expansion to a degree that is almost beyond imagination. But the UN Secretary General in 2020, in response basically to the COVID virus or the impact of the coronavirus, he mentioned that falsehoods were filling the airwaves. Wild conspiracy theories are infecting the internet. Hatred is going viral, stigmatizing and vilifying people and groups. And he made a call for a time. This is a time for science and solidarity. The WHO Director General in 2023, when WHO turned 75 years, also mentioned the presence of mis and disinformation, and said the lifeblood of WHO's work is science and evidence. So not only in the context of sexual health, but health in general, there are many concerns, and we have to keep going. We cannot just give up, and we have to, in addition to our focus on sexual rights and justice, probably increasingly also focus on the support and protection of science and sexual science in particular. And the future of WAS in science. There are a number of initiatives spearheaded by our president, Faysal, to maybe restructure some of our committees in terms of how they work together and how they are positioned with respect to each other. And so there's a possible new framework or so, which might include a science division where the Congress or conferences, of course, are part of, but also research in general, as well as potentially working towards guidelines for research and other related activities. I just want to share a few thoughts about this sort of how I look at it. And my role in this, by the way, I am an officer. I was the previous chair of the scientific committee, but as an officer, all the officers will take on some additional roles, of course, in assisting other initiatives within WAS. And for me, also given my background, this probably logical to some degree that I will be helping out where I can when it comes to anything related to science within WAS. And of course in collaboration with the chairs of the scientific committee. And science is foundational. It provides an empirical basis for knowledge, education, and policy in sexual health. We have values, we have ideas, but the best approach to policies, to education, to sexual health, also from education and clinical perspective, is grounded or supported by the best evidence possible. Sex education, ideally, obviously, is evidence-based, while respecting and recognizing the role of values and attitudes. Clinical practice, also assessment and interventions should be based on the latest insights in sexual response, function, relationships, intimacy, and be evaluated and tested for effectiveness. So we do, of course, have a continued commitment to science and are considering some additional new directions, including more actively, possibly supporting and facilitating and defending sexual health research. Also putting more effort in the training of young scholars, also through even our conference, the abstract submissions and presentations. We will consider creating ways to help, for example, as Faysal mentioned, maybe workshops and other ways to help strengthen the applications and abstracts and research of young scholars, facilitate collaboration and dissemination, advocate for funding and recognition of the field, and support and protect research data and findings. Which brings me to my last point that I would like to discuss with you, present to you, and that is the initiative of the World Observatory on Sexual Health. This was started already a few years ago, initiated by our past president, Pedro Nobre. So we should really give all the credits to him for starting this initiative, but we are working towards an increased effort to make this happen and develop and grow. The goals of this observatory are the development of evidence-based knowledge regarding sexual health and rights topics across the world, collect existing data, data sets, and conduct and facilitate studies that can be conducted in different countries, but using similar methodologies, etc. The main reasons, well, we need, as is very clear, evidence-based data on sexual health and rights. We need to better understand the relationships between sexual health, physical, mental health, global well-being, and inform interventions and policies to promote them. But it's also partly related to, the changes that we're seeing in the world and the degree of misinformation and the absence of information, and reliable information in particular, that we're trying to also address with this initiative by making information and data available and protecting it, safeguarding research in various areas, including what you see here. Is part of the WHO Global Survey on Sexual Health, was a major partner in this, and this whole initiative is also aligned with the World Observatory of Sexual Health. So there are a number of objectives more directly relevant to what we hope to be focusing on in the near future. To create a sexual health data hub, an online platform for data related to sexual health. Another objective is to analyze, synthesize evidence to inform the scientific community and make recommendations regarding understudied topics and important gaps. Promote the implementation of comparable studies on a variety of key dimensions of sexuality and sexual health across different countries. Disseminate existing knowledge on main topics of sexual health to the general public, and provide evidence-based insights to support policy development. So a very ambitious ambitious project, as you probably are thinking, and that is indeed the case, but we will start with small steps and keep rowing and rowing until the wind picks up again. Science knows no country because knowledge belongs to humanity and is the torch which illuminates the world. I will end with this quote from Louis Pasteur. Thank you.
Thank you very much, Eric. It is a beautiful ending, but it's a very interesting talk. And thank you for highlighting the importance of WAS as an engine and a hub of science, of research, and also in being part of leading science through partnership with WHO and also through the ongoing work with the observatory. Thank you very much. Our next speaker is our dear friend Esther Corona. Esther is from Mexico, and she is the vice president of WAS. Esther is the founder and the past president of the Mexican Association for Sexuality Education, and she'll be talking about lessons for the future, of course, coming from somebody who holds the memory of WAS and from somebody who has really contributed to WAS in many ways through collaborating with international organizations and also bringing all these organizations into WAS. So lessons for the future, WAS through 5 decades. Welcome, Esther.
Thank you very much, Faysal. And I'm very pleased to be here with you this morning. Morning for me, it may be evening or late evening or night. And that just shows that we are everywhere in the world. And I want to start first by, I have to, thanking all the membership that voted me as the most, with the most votes in the most recent election, which gives me definitely a very special relationship and a very special responsibility in this new leadership, of which I'm the sort of the old leadership link. And today I want to reflect on where we are, but also on where we came from and how we have traveled that road. This is, I think, very important because we are going to soon be 50 years old, which is a very old and ripe age for an organization, because many organizations do not survive through these long periods, and we have been able to do so even in the face of difficulties and problems, issues, local, internal, external. So I'm going to pick up 5 lessons from the World Association for Sexual Health through the decades. These are not the only milestones that I want to talk about. I mean, we have had many other, but these are some that have taught me something. And this is something that I would like to share very much on the personal reflection, but also how I see where are we leading. And we have been given right now a very good picture of how WAS can become a beacon for the world. And I thank very much Faysal El-Kak for showing us the way forward, and also to Erick for giving us this very important vision of how we stand on a scientific foundation. Well, WAS, the World Association of Sexology at that time, was founded in 1978 in Rome. And can we have the next one, please? And it was formed by representatives of national and international organizations and persons. And what went on at that meeting was that we all realized the importance of community, of doing something together, of really working in a concerted way. Even at that time, which was 1978, although we were coming from important world movements and revolutions, youth, and also scientific breakthroughs like the possibility of having safe contraception. And I mean, that was really a turning point for the world, and was a turning point also for WAS in the sense that we got together into this Third World Congress and decided to found a WAS. What I learned from that foundation was that community means strength, that we can speak in our own voices, present our own results of our research, our work, whatever we were doing individually, as individuals or as communities and societies. But coming from civil society, we were able to speak with a clear language, and we were able to move much faster than governmentals or intergovernmental institutions. We were ahead, and we were going ahead. Next one, please. What is, to me, what are the lessons for the future? We are a global community. We are comprised of 6 regional federations, but there are a number of regions and countries that we have not touched, such as Eastern Europe, Central Asia, Central America. And what we need as an action is to encourage reaching out these regions and assisting the development of civil society, even at a time when civil society is under threat. I think part of our mission is precisely to encourage all these persons working individually to form groups. And on the other hand, those that are working individually and are working sometimes thinking that they are having a role completely outside the rest of their communities, to join either local organizations where they exist or the regional federations. I hope to see that very much in the future. The next one. The second one that I think was a very important milestone was the time when WAS expanded collaboration and influence. At the beginning, at WAS, our professionals did not value or the importance of associating and working with international NGOs, thinking that they were very far, that they were not touching upon the topics that were very important to us. I mean, nobody talked about sexuality in the United Nations. Nobody talked about sexual health. Nobody talked about gender. These things didn't exist as such. So a turning point was when some of its members, I included, were present at the International Conference on Population and Development, ICPD, in Cairo, Egypt. Now is very often referred as the Cairo Conference, which has now reached 30 years. And of course, another anniversary that we're celebrating right now is also the 30 years of the Fourth World Conference on Women, which was held in Beijing, China. And for the first time in the hallowed halls of the United Nations, we could hear words such as sexuality, sexual health, and in Beijing, the mention of rights related to sexuality. What I learned, that we could not and should not work in isolation. We had to develop links to major organizations and find our common agenda. Next one, please. And for the future, which are what I see, what we have learned, what does it give us? we already have consultative status with ECOSOC, which is a formal relationship granted by the United Nations, and which allows us to participate in the United Nations work in a more formal way. And we have also formal relationships with WHO, with the Pan American Health Organization, and we are an implementing partner with the United Nations Population Fund. And we have to be there, the light that develops new thinking, such as sexual justice, this new initiative which we are launching, the topic and the theme of World Sexual Health Day. And but we have to nurture these relationships. We have to expand our partnerships with other organizations, but we have to nurture and to keep these relationships. And we need to recognize that sometimes we seem to be outside the interest of some of the topics that are being discussed, but our field contributes in the search for a peaceful and democratic world that we are looking at. Next one, please. Then another milestone was the Declaration of Sexual Rights and Sexual Health for the Millennium. In 1997 was made a very bold move in drafting a Declaration of Sexual Rights. And this declaration was written by a group of people who worked in a basement of the Palace of Music in Valencia, and while the big Congress was happening. And to me right now, the most incredible thing that none of us were lawyers, none of us were specialists in sexual or human rights, and yet we sat there with this dream and put together different codes and different declarations which were brought to us by many of the people that we were working with at that time. And we launched this declaration, which was for a time even known as the Valencia Declaration, which was then ratified 2 years later in Hong Kong, as a WAS declaration. And what I learned there, the power of collective vision, sometimes the recognition of a need and opportunities can move individuals and organizations beyond what they think is their own specific turf, even their own silos, and we can move forward and share and all this specific knowledge. And this is how we can build on some ideas that can shape and which can impact the world. Next one, please. Now then, these are part of the lessons for the future. Because I have to mention that years later, after we did this declaration, we realized we need to ground this in existing human rights language and existing documents. What we had crafted initially needed reworking, rethinking, and that's how the new declaration was launched, or the revised declaration was launched in 2014. With a special new force, which had a new declaration, which was grounded on universally accepted human rights. This is very important because it gives us the arguments against those that say that these rights do not exist. We also developed, to support that declaration, a technical document which can be used as to confront these allegations. I think that WAS needs to support innovative ideas and the creativity of its memberships with robust arguments and evidence. And to me, that the key principle for the future, as sorry, it's that creativity and daring thinking should never be stifled or ignored. The next one, please. The change of name. We were the World Association for Sexology, and in 2005, we changed into the World Association for Sexual Health, which was a response to the growing interest in sexual health, and also something that broadened our horizons. This transformation didn't come about. Everything is very organic. It came about as a result and of the way that we had been able to impact world organizations in changing and reconceptualizing and development of working definitions for concepts such as sexuality, sexual health, and related terms. This was absolutely incredible, but we did not have, did have, but the rest of the world, and particularly at international level, there were no common definitions. And we worked on those and we were able to produce them. Simultaneously, at the same time, and Faysal has just mentioned the SDGs, the objectives for the developmental objectives, but now, which are working right now until 2030. But at the time, what we had was the Millennium Developmental Goals. And for that, we also did something which I was very important, very interesting, and daring in trying to merge these two worlds, the world of sexual health and the international world. And we produced Sexual Health for the Millennium, which touch among some of the topics that are still very much alive and important today, such as sexual rights, as gender, with those names: prevention of sexual violence, sexuality education, access to reproductive health care, and pleasure, and also, of course, the connection between sexual function and overall health. And this was the first time, even at that time, 20 years ago, that we were talking very specifically about these topics in the context of international development. Next one, please. So what I learned that we need to move with the times. We need to recognize and respond to current challenges, but we have to keep non-negotiable principles as the support and foundation of our work, because the change was met with some kind of reservations from some of our members that thought that maybe we were losing our grounding in sexual science, in sexology. But this was not so. Next one, please. That we were able to merge the historical roots, the lessons that we had learned at that time, and understand the current change, and adopt practices which were adaptive practices, and also think about future possibilities, which is something that I still believe that we should be doing, this kind of change of linking the past with the present and also thinking about the future. I like to quote the words of Jeffrey Weeks, which is one of the world's greatest sexual historians on human sexuality, which he says that change can only be affected with a full understanding of the past, because history shapes our possibilities at the same time that we attempt to shape it again Yet we have to be flexible to move in a changing environment and facing new challenges, which is what we are doing right now, because we are precisely, I think, at another turning point, and we are very much with the responsibility of facing and using our past experience and moving into the future. The next one, please. And this is my last milestone. Well, I'm saying that it's not the last milestone, because we have had many others, and others will come, which was institutional building. Ever since the early 21st century, was embarked and saw the value of strategic planning, um, where we established major goals while while navigating at that time of very difficult economic issues for WAS. Uh, I mean, those haven't. I mean, we haven't surpassed those. We still need very much the help and the assistance and the support of our world community, but because this is also a very challenging time. However, limited funding was replaced by the effort and work of committed individuals, which supported our organization even in the face of these challenges, and even of the face of a growing at that time and now ever more external oppositions against sexual health, sexual rights. What I learned that that crises and challenges can be met when there is a backbone of a strong institutional plan that recognizes inner institutional strengths and weaknesses, as well as the context in which we are moving. However, nothing substitutes, in my opinion, the power and commitment of individuals and communities that are convinced of the value of institutional work. The next one, please. What are, to me, the lessons for the future of how we have been working on institutional building? Balancing structure and flexibility. Being aware of our environmental changes, and I mean environment and not only climate, etc., but our political and social environment. We have to explore it, and we have to be very much aware of what is the world we're working in. And we must remind ourselves that this is a multiple uh, picture that we have to face, because we are an international organization which is made up of many, many different countries, regions, and cultures. We have to build and on our strategic alliances and try to seek and build more. And we have to recognize that our ultimate goal is the universal access to full enjoyment of sexual health and rights. Next one, please. Well, I want to thank you for talking to you, coming from the past into the future. I also want to remember at this moment that very recently our first president, Romano Forleo, left us, died very, very recently. And he was precisely the kind of person that, coming from a solid scientific medical foundation, was able to change with the times and that work in a different setting. He was the first president, and now we are coming at a juncture where have this new leadership with a new president and a new group, but which is also, I think, very deeply aware of all the challenges that we have been through, and that is willing to face all these new challenges with also new ideas, and relying on science, and relying very much, as has been said before, not only with the head and with the brain, but also with the heart. So we have to in my opinion, move forward with this full perspective of where we come from, where we are right now, but also dream and think of where are we going. Thank you.
Thank you very much, Esther, for this amazing presentation and for reminding us all about the beginnings and about carrying on with the heart and core values of WAS, which is solidarity, commitment, but at the same time, resilience, openness to change, and moving forward based on the achievements of the people who started WAS, who are among us, and those who left us, and will continue to move ahead with that spirit and with that passion. It gives me a pleasure to introduce our next, last but not least, speaker, Elna. Elna is known to all of you. Elna is from South Africa. She is the immediate past president of WAS, and she is also the chair of the World Sexual Health Assembly Steering Committee. She's a medical doctor by profession. That's where she makes her living. But then she puts the living back into WAS. She is a medical doctor, as I said, sexologist, and the clinical head of My Sexual Health. And her topic today is WAS Up. And definitely will keep on going up. The World Sexual Health Day and the inaugural meeting of the World Sexual Health Assembly. Thank you, Elna, and welcome.
Thank you very much, Faysal, and thank you to everyone for joining here. It's wonderful to see everyone here in the comments. If you haven't told us where you are from yet, I would really like to see who is here and which country are you from. I am coming to you from the beautiful Western Cape, Stellenbosch, the Winelands. If you haven't visited yet, then book a holiday for the World Conference that's coming here in 2 years' time. We can't wait to host you. I just thought now, when WAS had its first webinar in 2020, I saw myself as the friendly girl at the door that lets everyone in. You know, I was the person that hosted it and just said welcome, and then got good speakers to fill the time, and then became the president of the Congress, and then the president of WAS for 4 years. And now it's absolutely wonderful to be at the end of this panel as the past president. I am extremely grateful for everyone that's gone before me here today, because it is a wonderful team that we have, and I enjoy working with such a strong team. I thank the team that has gone before them, Alan and Luis and Pedro, that served with me on the previous administration, but also the 50 years, almost 50 years of WAS now. And it is always wonderful for me to introduce Esther somewhere internationally, and Esther has more years of experience in sexual health than I have been alive. So it is so good to bring the generations together. And that is what WAS is about. It is very much about the community and about bringing sexual health to all, over all of the generations, all the phases of life as well. So let me not get carried away too much before I start sharing my screen here with you. And thank you very much also to Renee, our executive director, and Alzette, and to our team Pronk, who does our nice graphics and things. We've come a long way with that as well. So World Sexual Health Day is happening on the 4th of September every year, and I think everyone here already knows about it. I'll just give you a little bit of history about that. You see this nice picture of Rosemary Coates with her gold medal. Rosemary Coates is from Australia, and she was the only other female president of WAS before, and she started World Sexual Health Day, and that was in 2010, or it was under her leadership that it happened. But if you've been with WAS for a long time, you know that the efforts that go into World Sexual Health Day every year is the work of a big committee, and there's so much creativity that goes in there, and really many of us at WAS keep it very close to our heart, this project. So the aim is to promote greater social awareness on sexual health across the globe. As you know, WAS is a professional organization organization, and our work is mainly focused towards professionals. But this is the big time in a year where we actually focus towards the general public, and where we just want to create as much as possible awareness around a topic that is important for WAS and that we think is very important to create discussion around for in the rest of the world. And this year, our topic is sexual justice. What can we do? This comes at the back of the Sexual Justice Initiative, and there you see many members of the Sexual Justice Initiative that you know well. Esther, that just spoke, Alan Jami, that was a chair of this initiative, and our previous vice president, Esther Kismodi Bobby, who is now also serving on the advisory committee of WAS, Zara Stardust, and that is the co-chair of the Sexual Rights Committee, and Lisa Welsh. So, and with other people that have played a key role in putting this declaration together, we have had a collaborative process since the World Conference in 2021 that was hosted online here from South Africa. We started talking to people about what a sexual justice declaration should be looking like. And now finally at our General Assembly, when we were in Australia, this declaration was now finally ratified, and it's now the official WAS declaration on sexual justice. I love that picture of Alan, and he deserves recognition for really spearheading this initiative that we are very proud of. So if you look at these QR codes, if you quickly take out your phone and you snap them, this is the Sexual Justice Declaration here on the left, and then you also have the Sexual Rights Declaration that's been around since 2024, and the Sexual Pleasure Declaration, and all of them are on our website. So it is really because we want to get the world talking about sexual justice, and not only the concept of sexual justice, but what can we actually do to bring sexual justice about. It's not a very long declaration, and you can really read through it quite quickly, and please share it in your communities, people that you teach, in your clinics, so that we get a word around about the importance of sexual justice. And if you want to join us for the movement of what can we do around sexual justice on the 4th of September, please head over to our website. As you can see there, worldsexualhealthday.org, and there are many, many resources on this site. So there are nice pictures that you can download, that you can use just as it is on your social media. And there is a social media carousel that you can post. We have specific captions that we want you to use, the World Sexual Health Day 2025 hashtag and sexual justice hashtag. And then there's a great conversation desk to spark conversation. If you want to host an event, there's a participation guide. There's lots of reading that you can do, movies that you can watch, and there's a whole toolkit that you can download here at the bottom of the page. You can just click on that and download it. We've done a lot of work. We thanked Lynn Barkley, who's been the chair of the World Sexual Health Day Committee up to now, and Asha, who has put together this great toolkit for us. And we really invite you to make use of that, please. Now I just need to get back to my screen share again. Okay, so I want to remind you of the hashtags to use. World Sexual Health Day is really one of the most exciting days in my life because, I'm a 44-year-old mom, so I'm not the hottest on social. But on World Sexual Health Day, you have to have your phone around. It is super exciting to see all of these different people from all over the world that tags was our different social media handles and that uses this hashtag, and to see what they get up to around World Sexual Health Day. Don't miss out. Please get your local teams to do the same. Use this hashtag so that we can pick up that you are participating in this, and so that we can reshare your stuff. Because if you look in the stories of WAS on that day and the day after, it's really very exciting to see what everybody is getting up to. And then sexual justice, is, of course, as well as a hashtag on World Sexual Health Day, please. And then just some metrics, we keep a bit of track to see who participates in World Sexual Health Day. And really this year, we want to 10x what we've done next year. So please get on board with us and make a big noise about sexual justice locally. Then the next very exciting initiative that comes out of WAS that I think is the boldest leadership initiative that we've yet to undertake. It is as you've heard from the previous speakers, WAS has really accomplished a lot over almost 5 decades, and we want to build on that. We are worried about the threats against sexual health and rights, very worried, but we are taking strong leadership and we're building on the progress, because there's been great progress, and we are not going to succumb to all of the backlash that's happening against sexual health and rights now. So we, as a leader in sexual health and rights, the global leader when it comes to sexual health and rights, brings together the other organizations that work within sexual health and rights, and we all sit around the table. We work within the professional domain, but everybody there has a very clear mandate, and we're bringing everybody around the same table to strategize. So WAS is convening sexual health and rights organizations globally as the World Sexual Health Assembly. We're building on the progress that has been made, and the aim is to set strategic priorities and commit to coordinated partnership, advocacy, and action to address the backlash against sexual health, rights, and justice. So that is the aim of this assembly. So to put it into a context, there's the World Health Assembly, but at the World Health Assembly, there are member states who are not fully on board with the sexual health and rights agenda, and things still need to be said and need to get done. And it's important that the leaders do get in a room where they can speak freely and where we can set clear strategies. So that is why we will be meeting in Porto on the 5th of September. So what we've done thus far is, at the opening ceremony at the conference in Brisbane, we had we officially announced this initiative of WAS, and now on the 5th of September we are meeting in Porto. We've had, from our anonymous donor at WAS, we've had a donation of $30,000. If we can match that amount, this donor has given us $30,000 to make this meeting possible. But the University of Porto has also given us a huge donation in giving us their facilities, hosting a gala dinner for the attendees, and also doing the catering for us on the 5th of September, for which we are very grateful. And we have some upcoming events, local conventions of the World Sexual Health Assembly that will be meeting on a smaller scale at the FIGO conference, firmly establishing ourselves in the global south in South Africa, and then also in Bogota, and then we will be visiting our regional federation conferences as we do in WAS going forward into 2026. So the chair of the steering committee, I'm the chair of the steering committee, but Faysal is the chair of the World Sexual Health Assembly. The chair of the World Sexual Health Assembly is the president of WAS. And we have a steering committee that have worked together, really worked very hard to pull this off. And Alan and Louise were part of it initially while they were still on the executive of WAS as well. So the people that are attending this meeting, we have the really high-ranking officials from UN agencies that attend as observers. And then we've got executive directors and chairs and presidents of international civil society organizations. We've got the other professional organizations attending there and sending their presidents as well, and ISSM as an observer. Then we've got the key academic institutions globally to be there, because training in sexual health is of utmost importance if you want to move forward with some serious programmatic work, and our key publications as well. So we are super proud of the group of people that we got together, and we're grateful for people who are taking their time and many of them their own funding to travel across the globe for a one-day meeting. But we know that these partners see the importance of partnership to move forward to sexual health and rights for all. And we've got an inaugural donor list, and I really want to encourage you to partner with us and be one of the visionary leaders who believe in the power of partnership and the urgency to unite for sexual health and rights and justice. And one day when you see that the 27th World Sexual Health Assembly is meeting, you can tell your grandchildren that you were one of the inaugural donors of this extremely important initiative. Even if you donate $100, we are going to put you up onto the inaugural donor list, and you have a chance to do this until the 5th of September. You only have to transfer the money by the end of the year, but we will be sending out a pledge form after this webinar, and we will greatly appreciate it if you can sign up to be one of the founding donors of the World Sexual Health Assembly. As you see there, our anonymous donor gave $30,000. The value of the Porto's donation for hosting us is around $10,000, and then Eli Coleman and Jared given us $5,000. Faysal, our president, is coming there out of his own pocket, also donating up to $5,000. Elsa Almas and Esther Pirelli, who's been on the WAS Advisory Committee, have also been big donors for us. So thank you so much to those of you who have already signed up for this list, and I strongly encourage everyone else to please join this important list. Then there is a QR code that you can find our PayPal at in the US. You can get tax deductions for WAS donations, and there is our banking details if you could maybe please quickly take a picture of that, but we will also follow up with more information. And then I can just strongly encourage you to follow us on social media. We've got a great team full of energy. You won't be bored by what's happening on the WAS social media, and so that you can stay in touch. So with that, I thank you for your time, and thank you for giving me the opportunity to talk to these two key initiatives at WAS.
Thank you very much, Elna, for this beautiful talk and for bringing the two main initiatives, and also for showing that solidarity is not only about getting together and pushing initiatives, but also in helping each other, even with a few donations, as a sign of commitment to this solidarity and as a sign of commitment to WAS and to the work of WAS and to the passion that WAS is leading towards promoting and protecting the World Association of Sexual Health and the aims of the association. As a past president of WAS, you've been the most passionate and the most energetic, and you inspired all of us to continue with this spirit and with this passion. And I appreciate all the work that you have done yourself with the colleagues, officers of the previous term. And also, I want to thank my colleagues, my friends, the officers of the new term, and thank all those who have been attending this webinar, not only to learn from us and to see our new plans, but also to give us feedback and to give us comments and to give us guidance on where to go there and go together to that route. Thank you all. Thank you also, Renee and Michelle and Zed and Lisa and all the others and the whole team behind this. I want to open the floor. I think we have time for some questions. May please, Renee, tell us about these questions so we can have some answers.
Yes, I think we did get some great questions. And the first one is actually to Erick. So, Tamari from Kenya has written to you, Prof. Janssen, what a pleasure to listen to you this evening. I had the pleasure of having you as my jury during my PhD defense 13 years ago. Thank you for sharing about the WAS and science, the importance of generating evidence to inform programs and policies, as well as the need to push forward even in the face of funding shifts. A quick one, Africa is left behind in all ways, sexual health education, research and care. Is there something that WAS is doing to support this in the spirit of equity?
First of all, so nice to see you here and to receive a message from you, Tamara. You're doing absolutely wonderful work. I'm not sure if I'm the best person to answer this because I think Faysal or Elna, maybe you could also say a bit more about the formation of the SHA federation, federation in Africa, which I think is going to be a very important part of in part an answer to your question, in terms of WAS commitment. But I don't know, Alna, Faysal, do you want to maybe say a bit more about that initiative?
I'll say a few words and then give it to Elna. WAS definitely is committed, and WAS, as I said before, is the agent of the marginalized primarily. And WAS is the agent of the South. And also it is a global association, of course, and we're proud of that. But we're not global unless the South is important in this association. And we're not global unless Africa, Southeast Asia, Latin America, and the Middle East are there. And that's why the previous officers, the past president, have been pushing for federations, new federations in the East Mediterranean, and also the importance of including Africa in many ways. We are thinking of issues like research training. We're thinking of issues like supporting initiatives. We're thinking of issues like centralizing some of the most important work within Africa. We hear you very well. We're aware of this. And I think that will be our top priority. Elna, I'm sure, through the African also Federation, have done lots of work. And if you like, Elna, to say something on that in that respect.
Thank you, Faysal and Tamari. Yes, I am thrilled that we got our very complex democracy within WAS at our General Assembly to vote for our advisory committee. We had plenty of excellent candidates. And when our General Assembly voted, they voted on are we 4 or 5 people from Africa on the WAS advisory committee now, plus also the Middle East, as well as the South America and Asia Oceania. We've got strong global South representation at this level now, and it needed to change, and I am proud of the fact that it changes and that we didn't have to force, well, we had to fight hard to get things in place for it to change, but that in the end our advisory, our General Assembly as a group voted to have people like you, yourself, Tamari, on this committee to push for this kind of change. I think the World Observatory is a key project for us to do this. We are focusing at our journal to get more work published from Africa. But for me personally, our next step, and as Faysal rightly said, and Erick, through the Sexual Health Africa, which is the African Federation for Sexual Health, to make sure that we can build strong institutions in Africa. That's what you need, strong academic institutions in Africa. At the World Sexual Health Assembly, we're convening the strong sexual health institutions globally. Sydney from Australia, we've got Erick's unit there from Belgium. We've got the Eli Coleman Institute there from America, but where is the institute from Africa? Because it's basically non-existing on the continent where it is most needed. So that is, and I know, Tamara, you guys are working very hard in Kenya to put it together, but there is a lot of work that needs to get done to get it legitimized and to have it common practice through every university in Africa, to have sexual health units there that does proper research and proper education and advocacy. So, as well as clinical services. We'll get there. We're pushing for it, I promise you.
Thank you, Elna. I'm just seeing a lot of people thanking the speakers for such a wonderful webinar, and I want to add to that and then ask a few questions to our president. So, Faysal, Jean-Paul asked, Mr. President, thank you very much for mentioning solidarity in these times of financial crisis. Do you agree with me on how to redefine the word solidarity? I think that's a bit of a difficult question, how to think about solidarity going forward. But perhaps, Faysal, you can just share with us how would you describe, or what is your view of solidarity specifically?
Well, if you look at the Webster dictionary translating solidarity or explaining solidarity, it has many explanations. But at the end of the statement in the dictionary, it all means coming together. I think the smart thing about solidarity is to pick the effective and the cooperative partners. That's solidarity. And we know solidarity, even among weak partners, have made a lot of change, whether politically, socially, or economically. Solidarity, Jean-Paul, is about picking your partners and picking your achievements and your battles and work for that together. So whenever, whether you call it solidarity, whatever you call it, but just make sure that you pick the right partners. And I think it was over the past 50 years, we've picking the right partners and we've been promoting sexual health and rights in that regard.
Thank you, Faysal. Now, from an anonymous attendee, we have this question that I'm going to put to Esther and Erick, perhaps to answer. So the question is, why do you think or sense that research in sexual health is under such threat? What is the reason for that? Esther, what is your explanation and views on that question, please?
I think there is no single answer to this. I mean, we have to look at the world situation and the shifts that we have had in the political architecture. I mean, in a world which is shifting to the right for many reasons. I mean, we would have to understand and go back a few centuries and even to the Greeks to work on why these shifts take place. But I mean, there is this feeling of insecurity, uncertainty, which is very threatening for people. And that's when people take refuge in this kind of movements, which see not only sexual health research, but it's a full gamut of ideas. It's rights in general, human rights. It's not recognizing that we are all, as the Declaration of Human Rights says, we're all born equal, but thinking, that there are differences, that feel threatened by diversity, by anything that is different, but by anything which goes out of the box, out of boundaries, which has, from my point of view, what has allowed us to move forward. But I mean, I mean, what has been the threats against, not, as I say, not only research. We would have to look, and we are doing this through our Sexual Justice Initiative and through also the Sexual Health Assembly, in trying precisely to understand what are the currents, what are the shifts, and how we can best move forward and use all our back experience and look also at how these trends seem to come and go. But how, I mean, we are, I believe, in the world at a very difficult time, and as I say, it's a turning point. We really have to look ourselves and think ourselves as human species, how we can solve these quandaries. And I think that going into precisely into research into sexuality, which is one of the most fundamental and one of the most, I would even say, although I don't like the word, essential parts of being human, as we have defined it in our working definition. I think that precisely we have to look into these areas to find out the multiple answers, and also rely, of course, on what experience and evidence show us.
Thank you, Esther. Erick, are you going to also perhaps just provide a short answer to what you think and what you think the reasons are?
I'm not sure what I can add to so much wisdom in this respect. Other than that, I think it's the topic itself. It is a sensitive topic, sexuality. It's a contentious topic. There are so many people in the world who are worried that even using the word sex is already going to have a negative impact on people's behaviors right now, and probably will. There's so many misconceptions about it, but also agendas, conservatively driven agendas that want to keep sexuality out of anything mainstream. There is no National Institute of Sexual Health in the US, but there's also nothing like it in Europe. There are we always have had to find very creative ways to get any initiative, if it's research related or sex education related. We have to be very creative in getting things funded. And what's underneath it, I think ultimately, I'm a psychologist by training. Ultimately, I think it has a lot to do with just the mere sensitivity of the topic. And that's why our role is so important as an organization.
Yes, thank you. I agree 100% with you, Erick. Okay, we have one very quick last question to our president, and that is, what key lessons from the past of WAS do you, as visionary leader of WAS, build upon to lead WAS into the present and for the future?
Well, there are many lessons, but the most impressive one for me is the endurance. You see, it's not easy to navigate this world or the geopolitics of this world with sensitive issues like sexual health and rights. And WAS did not only navigate, but was leading openly with greater partners and collaborators. And for the future, what I would say is definitely be open to change, be open to being flexible, be open to new ideas, be open to new perspectives that will allow you, among all this complex geopolitics, to keep on pushing, to keep on promoting, to keep on guarding sexual health and rights. And this is what WAS is doing. And that's what we will continue to do in a more effective and in a more kind of resilient way, with the help of the officers, of the AC, of the assembly, and all of you in there, the federations and the global partners.
Thank you so
Thank
much.
you.
We are now going to close this webinar. We've reached the end of the webinar. I think the last thing I want to say is just to remember World Sexual Health Day is right around the corner, and we are asking ourselves, what can we do? And I think that is what we want you to go home with. Go and think about that question. What is it that you can do personally? Because it always starts with yourself. Thank you very much for joining us for this webinar, and thank you to our wonderful new team, our new administration. We are all blessed and privileged to be part of WAS. Thank you so much.